Solution-focused therapy is another cognitive behavior approach, and these are some really helpful specific concrete tools that you can use pretty much for all of your patients with any education or developmental level. They really are helpful in eliciting change. The first one is the scaling question. On a scale from 1 to 10, with 1 representing no motivation to check your blood sugars, to 10 representing the most motivation you have in checking, where are you today? And I like to just write out a scale right in front of them, and they circle it. So you checked a 3. What would need to happen to get you to a 6? What would need to change for you to happen to get you to a 6? Or you were a 6 last week. This week you're at a 9. What's changing for you now? Acknowledging their strengths and what they're doing and how they're feeling about it. The exception question. Has there been a time in the past when your blood sugars were in better control? Was there a time when you were able to commit to a meal plan? If so, what were you doing then that you weren't doing now? This helps them to understand what their barriers are currently and what they need to do to get back into that place to have blood sugar control, to feel good about themselves. It puts it back on them to come up with the ideas as opposed to you coming up with the suggestions. The miracle question. For an ambivalent, this is again for patients who are still struggling with ambivalence. Let's say a miracle happened in the middle of the night and all your problems you had managing your diabetes are gone. What specifically would you be doing differently to make this miracle happen? This allows the woman to look at not only what she needs to do concretely with her behaviors, but where she needs to be mentally, emotionally, to help her identify what she needs to do, what behaviors need to change to have glucose control. So now we're going to shift over to culture. And before we do that, I'd like Cynthia to ask one final question, please.
Okay, here we go. Our last question is, and I apologize for the limited options, but this is all we have. What is the largest ethnic population seen at your facility? Hispanic, Asian, Native American, Middle Eastern, Asian, Indian. We've only got 5 slots to fill, so let's go with this. Okay, we're at 70%, 75, okay, I think we've got everybody. So 80% Hispanic, 7% Asian, 8% Native American, 1% Middle Eastern, and 5% Asian Indian.
Very good. Thank you, Cynthia. So I'm glad, actually this is very comfortable for me because we work with a lot of Hispanic patients in Sacramento. So it looks like the vast majority are Hispanic and the next one is Asian. What I really find that really helps engaging patients of different cultural, ethnic backgrounds, first of all, is obviously what level of generation they are. But group appointments, I think really help empower these patients and give them a level of support as well as elicit change for them. We've been, especially with our Hispanic population, first generation, I see the group process go really well because the questions, the challenges they have tend to be shared. I usually have a dry erase board where I write down some of the common challenges that brought them today, and then usually there's someone in the group who has some suggestions on how to deal with it. There's a lot of discussion going on. It really tends to help elicit these changes and help them find something that works for them, that they're going to find value out of, that's suggested from somebody they identify with. We have started using, I'm sorry to go off on a tangent, we have done more group appointments just to accommodate the rising referrals we've received because we've changed our screening guidelines in Sacramento. So we've gotten a very large population now and we're trying to get them in timely, and group sessions tend to be very helpful, especially for people who you see some more homogeneous characteristics with each other. So LEARN is a great acronym, or it's an acronym that we use to address culture and different ethnic groups that we may not understand a lot about, but certainly can help to engage somebody from a different ethnic background. And I did not address this on a slide, but I also want to stress the importance of always using an interpreter, a trained interpreter if you can. I know some clinics do not have access to funds to pay for this, but as opposed to using a family member or somebody who's not trained, a trained interpreter usually spends a little bit of time with the client beforehand explaining how they're going to be speaking. They know the position, their physical positioning in the office, always using the I as opposed to the she pronoun because you're wanting to develop a relationship between the provider and the client, not between the client and the interpreter. So that said, let's go on with the LEARN model, or the LEARN acronym. So listen to where the women's perspective is. How do people get diabetes? How do they get them? What is your knowledge base? And how do they treat diabetes? I really want to know. This is, again, where you're using active listening. What expectations are placed on you? Who cooks and who tells you what values, what practices you need to practice at home? And giving birth in a different country, how does that feel? Is this the first time delivering in the United States? What are your concerns or fears about delivering here as opposed to back home? They actually may feel, they may have a sense of hope, but they also may want to hear the differences in what they can expect. Examples of listening. In this women's culture, what do pregnant women eat? What foods are discouraged and what foods are encouraged? Who has the authority to tell you about diabetes and how to care for your pregnancy? This may be somebody that you want to invite to appointments so that you want to see that they also are agreeable to the plan. Are there any financial issues or other concurrent issues interfering with your self-care? And I really would like to address them today, because let's see if we can come with a plan that works for everybody. Again, we see expressing empathy and how important that is to understand and show respect and value for their wisdom, for their knowledge base. That sweet success may interfere with those efforts and their traditions, and it's not the only method of diabetes management. That their practices definitely have a place here. I had a Mexican patient who believed that when she got into a car accident, it created something called a susto, where she thinks that's where her diabetes came from, this fear that caused her to get diabetes. And actually there was some validity behind that, because we know stress can certainly elevate blood sugars, and it wasn't important to argue that point or discredit it, but to understand it and give it value. Appreciate the longing for forbidden foods, especially if they conflict with her diabetes plan. With our Asian population, rice is a huge staple. It's a big part of their plate serving, and this can be definitely difficult to stay within their carb regimen if rice is something that is traditionally used at breakfast, lunch, and dinner. Examples of listening. In this women's culture, I'm sorry, did I go over that one? Okay. Examples of empathy. Sorry. Okay. Acknowledge that, I think I talked about this already. Acknowledge that diabetes during pregnancy is different from diabetes for a non-pregnant woman. If the cultural practice is generally safe, assure that her knowledge is valuable and will have a place again in her family. This is not forever. I already talked about that, I'm sorry. In this women's examples of listening. In this women's culture, what do pregnant women eat? What foods are discouraged? I think I already talked about that, I'm sorry. Oops, I see what I'm doing. I apologize, I'm going wrong order here. Okay. Acknowledge the value of healing body, mind, and spirit, looking at her holistically, not just from the food perspective, the medical perspective, but what's going to influence her diabetes. Where does she need to be? How does her faith interface with this? Her knowledge of healing and the values that it's going to be in her diabetes self-management. Examples of acknowledgement. If the cultural practice is generally safe, assure her that this knowledge is valuable and has a place here. The nutritional guidelines incorporate as many ethnic foods as possible. If you are, again, for those of you who are seeing a large Hispanic population, be familiar with certain practices. Nopales is something very traditional among the Mexican community, and we've actually seen it actually reduce blood sugars. Bitter melon in the Asian community is effective for blood sugar reduction. So being familiar with as much of their food choices, their preferences, and utilizing that as opposed to obviously more Western food choices. Recommended treatment plan while being aware of her mixed feelings, her conflicts with it, emphasizing that we all have the same goal of her having a healthy baby, and sharing success stories, encouraging her to share those stories, as well as validating that there are other women who also experience those feelings and how they overcame those frustrations and challenges. So examples of recommendations. Recommend a way to communicate with people of authority in their family. who maybe question the need to adhere to this medical or excuse me, this nutrition plan. And again, invite them to come. Does this work for you? What are your thoughts on this? If not, what can we do? What are some of your suggestions? And incorporate that person's suggestions and feedback into the diabetes plan. Recommend ways to communicate with family members and friends who question. Or minimize blood sugar testing. How important is this? Is this really important? Well, let me tell you, let's spend some time telling you about this and really valuing their place in this woman's diabetes care. And finally, negotiate a treatment plan that everybody can agree upon. It's not an us versus them, or this is the only plan we're going to do. What plan do you feel that we can all agree upon, that it is something that you're using from her as well as people that give her direction, that's sensitive to her own cultural background, and that is going to help her achieve blood sugar control? Examples of negotiation, it's ongoing. It's always going to be changing. Staff need to learn at each woman's visit how to provide cultural sensitive care. What does taking insulin mean? Does this mean that your diabetes is more serious now? Does this mean that something bad is going to happen? Really want to address those fears. Her goal for this pregnancy may be different from the team's. For example, she may be hoping for a big baby, and as we know, some cultures believe big babies are healthy babies, where in fact we may want to talk about, well, a big baby may actually show some difficulties with blood sugar control and other metabolic problems at birth. But let's talk about how we can reach a shared goal. And that is it. Thank you.